Hello, fellow parents. Mike Allen here from the Family Life Office of the Catholic Diocese of Lexington. We recently surveyed parents from across the diocese regarding the challenges we are facing during this pandemic and lockdown. Your responses prompted us to initiate a series of conversations with local resource persons who can give us practical guidance and tools for some of these challenges. And so I'm really happy to introduce you to Dr. Katie Terhune, who is an assistant professor of the School of Social Work at Northern Kentucky University. She got her PhD in gerontology from the University of Kentucky, as well as her master's degree in social work. She's a licensed clinical social worker with 14 years of experience working as a mental health therapist with individuals, couples, and families. And her primary clinical focus is on the treatment of depression, anxiety, relational problems, grief, trauma, and issues related to caregiving. Dr. Terhune's teaching, research, and clinical work all reflect a commitment to improving emotional well-being. She and her husband, John, are Mary Queen parishioners like me and have 7 children. Dr. Terhune, thank you for taking time to share your experience and expertise as a clinician, an educator, a parent, and as a Catholic with other parents in the diocese. So hello.
Hello, and you're very welcome. I'm really happy to have this opportunity, so thank you.
Well, as you know, we surveyed parents in the diocese regarding these challenges. I mean, parenting is hard in normal circumstances, but
Yes.
particularly in a pandemic and lockdown. Out of the 170 or so responses, over a third of parents identified anxiety as a challenge for their children, and 42.5% of parents identified anxiety as a challenge in their own lives. So I thought we'd address some of these issues. From a clinical perspective, what exactly is anxiety, and is it synonymous with stress?
So anxiety is often a normal response to the stress that we experience in our lives. And in many cases, the anxiety is considered normal or common or congruent with whatever the situation might be that we're experiencing. So for example, if we have a job interview or right before the first day of school, we're going to feel anxious, and that is considered normal, that is considered congruent. And typically that anxiety is going to disappear after a short period of time, and it typically does not disrupt our day-to-day functioning. With an anxiety disorder, however, the anxiety does not disappear over time. In fact, it is likely to just get worse over time. And we start seeing significant disruption in our daily lives. So disruption with work, with schooling, with maintaining our relationships. So that's when it starts to become problematic. So from a clinical perspective, what we look at duration and intensity of the symptoms. So with most anxiety disorders, we're looking at, are they lasting for 6 months or longer? And are they causing significant disruption in a person's day-to-day lives? So in their social lives, in their occupational lives, and so forth. So anxiety affects all aspects of ourselves. It affects us physically, it affects us cognitively and emotionally. And there are a variety of symptoms that we see in adults and children. So if we want to take a look at some of these symptoms, there we go. So these are some of the common symptoms that we see in adults. Now, a person with an anxiety disorder, they may not necessarily experience all of these symptoms. It depends on the person. It depends on how the anxiety manifests itself. So some people may have a few of these symptoms. Some people may experience nearly all of them. So we see that we have symptoms that affect our physical functioning. That's typically what people notice first with anxiety, is how bad they feel physically. So they feel it in their chest, they feel it in their heart rate, they feel it in their muscles, they feel it in their stomach, they feel it in their head. So anxiety is very physically debilitating. It affects our thinking. People often have racing thoughts where they just can't calm down their thought process. They can't stop the feelings of fear. And of course, it can affect their mood as well. I do want people to recognize that irritability and anger can sometimes be a symptom of anxiety. I feel like this symptom often gets overlooked as anxiety. We think, oh, I'm just in a bad mood, or I'm angry about something that happened. But it can be a symptom of something else. So I just want people to be aware of that. If they notice that they're becoming short with people or snapping at people or having a reaction that really is not congruent with the situation. I would encourage people to really pay attention to that, because it could be an indication of something else other than just being in a bad mood.
Mm.
And then if we look at some of the symptoms for the children, so there's a lot of overlap. There are very similar symptoms with children, but there are going to be some things very specific to the way the child reacts. So there are different types of anxiety disorders. So in children, it might manifest itself in being afraid of being separated from a parent or a caregiver. It could be a specific phobia, so being afraid of a specific object or an animal or a situation like going to the doctor. It can affect sleep and appetite. Again, you see the physical symptoms, so children can experience significant physical symptoms in terms of pounding heart rate, tightness in the chest, difficulty breathing. And again, we see that irritability and anger part. So watch for that in your children. For my children, I always pay attention to complaints about headaches and stomach aches. If one of my children comes to me and is complaining about their tummy hurting, and sometimes it is just a stomach ache or something they ate, but I always follow up with some questions. Are you nervous about something? Is something bothering you? Is something upsetting you? Because that can be an indication for anxiety in children.
Mm. So, Dr. Terhune, do you think it's fair to say that, we know, or it seems that the issue of anxiety in our culture is a rising concern? Do you think that this present crisis only shines a fresh light on that? And if so, what do you think is behind the general rise even beyond this pandemic?
I think that is a very fair statement. Depression and anxiety are already prevalent in the United States, and we are already seeing increases in prevalence, especially among our youth. And the COVID-19 crisis has truly exacerbated mental health. If we go back to that slide with the statistics, looking at some recent survey research regarding the COVID-19 crisis, it's clear that it is absolutely affecting people in terms of their mood, in terms of feeling anxious, in terms of their overall perception of their mental health. So I think it's definitely shedding light on problems that we've already had and definitely making them worse. There are conversations taking place about the aftermath of this crisis and what that's going to look like to our mental health system. Are we prepared to deal with these numbers and to deal with rises in depression and anxiety? And making sure that we're not missing what's happening to our children and our youth, making sure that they're not getting lost in all of this as well. So those conversations are happening, and I think it's yet to be determined what is this going to look like in the aftermath, and are we prepared from a mental health system standpoint to provide the services necessary to adults and children. But it's clear, just looking at these numbers, it's affecting people.
So how do you think the specific issues surrounding this current pandemic and lockdown add to the challenge?
So COVID-19 has changed life for us as we know it. There are so many unanticipated stressors. Fear of the unknown is one of the core human fears, and that's precisely what we are in right now. It's the unknown. There's not a lot of answers. There's not a lot of certainty. So there is that anxiety of just not knowing what lies ahead. There's been a lot of loss. I think loss is really a prominent issue right now. There's loss of loved ones. There's loss of finances and jobs. There's loss of traditions and hopes and for our future. So we're experiencing loss across the board, and that has a lot of implications for our lives. I've had a lot of conversations with some parents who have children with special needs. So that could be children with emotional or behavioral health challenges, or children with physical health needs. And what they're experiencing right now is all the services that they were connected to prior to COVID-19, those services have been halted or eliminated temporarily. And so these parents are now left to deal with these children in the absence of those necessary services, and they're struggling. So we have that issue as well, that the support systems that were in place for helping parents with these children dealing with a variety of issues, that looks very different now. And what does that mean for the whole family? So that is something that we're seeing more of, and I'm hearing those conversations from quite a few parents. And I don't always have good answers for them. I mean, if those services aren't available, they're not available.
Our parenting survey, Dr. Terhune, also indicated that 20% of parents identified depression in themselves and 20% of parents identified depression in their children.
Mm-hmm.
From a clinical perspective, what is depression and what are some symptoms of it?
So depression is a mood disorder that impacts the way we feel, think, and behave. So similar to anxiety, it impacts just about every aspect of our being. So similar also with anxiety, it is completely normal to feel sadness at different points in our life. It's normal to experience grief when we've gone through a major loss. But with depression, what we look at is, again, duration and intensity of symptoms. So when symptoms are not getting better, when they're lasting longer, and when they start to significantly disrupt our daily lives, that's when we start to look for the possibility of depression diagnosis. So here are some of the common symptoms that we often see in adults. And again, not everyone is going to experience all of these symptoms. It's going to depend on the person. What we look for from a clinical standpoint, they have to have 5 or more of these symptoms over a 2-week consecutive period of time. And these symptoms have to be significantly impairing their day-to-day life. So their relationships, their work, their schooling, and so forth. So we see symptoms, again, symptoms that affect us physically. We have fatigue, we have aches and pains, we have changes in sleep and appetite, we have feelings of guilt, worthlessness, we have irritability, difficulty concentrating. So we see similar symptoms to anxiety, but depression, there's more of that mood component affecting the way we feel and the way that we think. We also have a set of symptoms that we typically see in children and teenagers. So similar to adults, that irritability and anger piece, again, I want to emphasize to parents, don't overlook that in your children. I think it's very easy to just assume, oh, well, they're being a moody teenager, or they're just mad because they didn't get something that they wanted. But irritability, especially if it's heightened or not typical for your child, pay attention to that symptom, because that can certainly be an indication of depression in childhood and in adolescence. Sometimes depression can manifest itself in terms of defiance and behavioral issues, so we want to look at that piece as well. Pay attention to statements that from your child, such as, I can't do anything right, or nobody likes me, or it's all my fault. Some of kind of those all or nothing statements that are very negative, very self-blame in nature. Pay attention for really severe symptoms such as self-injury, and talk about suicide or thoughts of suicide. Now, children and adolescents, they may not always be forthcoming about these thoughts, and so it's up to us as parents to talk about that with them and ask about that. And I will talk about that a little bit more when we talk about the treatment aspects for depression.
Is there a relationship between anxiety and depression?
There's absolutely a relationship between the two. So 50% of people with major depression experience severe and persistent anxiety. So if you think about anxiety, if you're living in a persistent state of fear, or with this sense of a loss of control, that's often a gateway for depression. And the other way around too. With depression, many people have very negative thoughts about themselves and about their lives, about their choices. They live with a lot of guilt. So that's certainly going to cause anxiety. So in essence, the two have a complicated relationship with each other, and they really just feed off of each other and exacerbate one another. So it's important to recognize from a clinical standpoint if there are symptoms of both, and it's necessary to treat both. We really can't treat one without treating the other.
Sure. So in what ways can parental anxiety affect childhood anxiety and vice versa?
So first we have the issue of genetics. So Children of parents who have an anxiety disorder are 7 times more likely to also develop anxiety. So there's clearly a genetic component. And then we have the issue of learned behavior. So our children are always watching us, they're always observing us, they're always listening to us. So if you have a parent who has anxiety, they might be modeling unhealthy behaviors or maladaptive coping skills that the child just presumes as normal because that's all that they know. So what that means for the child is that they might start to interpret certain situations as being dangerous or unsafe that in fact may not be dangerous at all. They might start to model coping skills that are maladaptive, such as avoidant behaviors. So rather than dealing with the anxiety or coping through it, they're simply avoiding it because that's what they've watched the parents do for years. If you have parents who, if their anxiety manifests itself in overprotective or over-controlling behaviors, then that can really prohibit the child from developing their own sense of independence, from developing their own coping skills and their own problem-solving strategies because the parent has just been there in an overprotective manner, not allowing the child to develop those essential life skills. From the other side of that, having a child with anxiety, that can certainly impact the parents. What I have seen in the parents that I've worked with, just a lot of heavy emotions associated with that, feeling helpless, feeling fearful about what is life going to look like for my child, a lot of self-blame, a lot of frustration. So that obviously is going to impact the parent in their interactions with the children. Anxiety is also, it's a family issue. If there's a child with anxiety, it's not uncommon for a lot of decisions to start centering around that child. So there might be things that the family is not able to do or events they're not able to participate in because of issues with the child with anxiety. So it ends up affecting the entire family dynamic. So I always say that anxiety and depression are family issues. It's not just about that one person experiencing it.
You know, in our experience as parents, there's probably nothing harder than seeing your child suffer and feeling like you can't do anything about it, whether that's a physical illness or problem, or if it's an emotional, issue or a mental struggle. And of course, it all goes together. What would you say to the parents who feel helpless right now? They have a child dealing with anxiety or depression, maybe some encouragement you could give them.
Sure. Well, the first thing I would tell people is it's okay to have those feelings from time to time. I think we have to give ourselves permission to feel helpless at times, to feel, experience that grief and that frustration. That is okay. What I don't want parents to do is to continually blame themselves or beat themselves up for how did this happen or what didn't I do? Where did I go wrong? And continually going back to that early narrative. And here we go. Here he is.
No.
My youngest Noah, we're keeping it real. This is what my daily life, work life looks like now. Thank you.
No worries. No, like I said, that adds to the authenticity of it.
Yes, we're keeping it real, folks. This is life right now.
That's right.
So what I encourage parents to do, rather than staying stuck in that what if or how did it get to this point, rather than staying stuck in those questions, because there's really no, I don't think that's fruitful. I don't think that propels us forward. Put that energy into the how-to questions. How do I move forward with getting my child the help that they need? What are some new options I haven't explored? How can I better support myself in this process? So just really channeling that energy that you're putting into these questions, these ruminating questions that don't really produce any fruitful answers, put that into questions that will propel you forward. I also encourage parents practice a lot of self-compassion. And what that means is that learn how to give yourself the same amount of compassion, grace, and understanding that you would give to pretty much anyone else in your life if they were going through the same struggle. Oftentimes we deprive ourselves of the compassion that we would give to anyone else. So be really intentional about practicing self-compassion and acknowledging that you're doing the best you can. The other thing I would recommend is to not be isolated in this process. Don't try to figure this out by yourselves. There is support available on many levels, and we don't have to move through this process. We don't have to navigate this alone. It already feels very lonely and very challenging. And so I encourage parents, reach out to other parents who are in similar situations because they get it. They're not going to judge you. They're not going to chastise you. They're going to listen. They're going to share ideas, and they're going to have compassion for you. So don't make it harder for yourself by trying to navigate it alone.
So what then are some practical behavioral tools for anxiety, whether for adults or children?
Sure. So there are a lot of options. That is the good news, is that anxiety and depression are very treatable for individuals of all ages. So the first thing I recommend, and of course, I'm very biased as a therapist, but therapy is really one of the best things you can do for yourselves and for your children. I think everyone should be in therapy at some point in their lives, regardless of what they're going through. I've been to therapy, and I've been on the other side of that. It's been helpful, and so I do strongly encourage adults and seeking it for their children that you seek some type of therapeutic services. So that can come in different forms. That can be individual therapy, that can be family therapy, that can be group therapy, or even couples therapy if it's something that's affecting the couple. So for anxiety, there's a lot of research supporting the cognitive and the behavioral therapies. Certainly a lot of empirical support for those treatments. They're very effective. And what those types of therapies do is it teaches us to recognize how our thoughts perpetuate anxiety. We cause a lot of chaos right up here, just in our own mind. So the way our thinking patterns can certainly make anxiety worse. So cognitive therapies and behavioral therapies, they teach us relaxation. They teach us how to manage our thought processes. They teach us how to cope with irrational thinking that can make anxiety worse, and they can be very, very effective, and they work for children too. Medication is a possibility. So and we'll talk about that a little bit later too. That certainly can be helpful, and research does support that medication in combination with therapy is often the most effective forms of treatment for anxiety. For adults, I recommend reducing caffeine use. And I know caffeine is a staple for many of us. It's a staple in my life, especially now. But excessive caffeine can actually make your anxiety symptoms a lot worse. So just be mindful of what your caffeine intake is. You don't need to cut it out altogether, but you might just need to reduce it or cut it off earlier in the day. I try to teach my clients how to look for the red flags. So look for the warning signs. How do you know when that anxiety is starting to increase? How do we know that we might be on the verge of panic? Our body and our minds warn us. We just have to get to a place where we listen to our bodies, listen to what is happening up here. So really getting to know those red flags and those warning signs so that we can put some preventative measures in place and cope with the anxiety more effectively. Education is key. Once we realize that anxiety is a problem for us, then educate yourselves on it. There's no shortage of education out there on anxiety. It's easily accessible through the internet. And so the more educated we are on something, the less power it has over us. Try to establish predictable routines, not to the point where it has to dictate your entire day, but routine is important in managing anxiety. And set new and healthy boundaries for yourselves. What I have seen in my clinical work is that so many of our problems can be traced back to a lack of boundaries. So a lack of boundaries just invites chaos into our lives. And so I think now more than ever is a great time for us to reevaluate our boundaries. And what I mean by that is boundaries for yourselves, boundaries for your family. What do you consider acceptable and unacceptable for your life? And you have a say in that. So now, with the COVID-19 crisis, I think this is an ideal time for individuals and families to really take a look at their boundaries and determine, is this sufficient for what we're going through right now? So with children, again, we're going to see a lot of similar treatment options: therapy, medication, education. It's up to us as parents to provide emotional safety for our children. And we do that by not being reactive to them. We don't have to be emotional weather vanes with our children. I'll be the first to acknowledge that that's really hard. And I know we're not always going to be able to do that. But when we recognize what our child is struggling with, when we recognize what that anxiety looks like for them, if we can respond with calm and emotional safety and a safe place for them to come to us and talk about what they're going through, that does make a difference. We also want to teach and model healthy coping skills for them. As I said earlier, they're watching us, they're learning what we do. So if we're modeling for them how to cope with anxiety in a healthy manner, they're likely to pick that up. And then praising any accomplishment, no matter how small, anything that they're doing, make sure that you're reinforcing the good behavior, or the healthy coping that they might be using, and praise them. That's going to matter quite a bit.
Hmm. And what are some practical behavioral tools for depression, whether for adults or children?
Sure. So we're going to see some overlap. Again, I can't emphasize enough just how important therapy is. We're going to use some of those similar strategies, cognitive behavioral treatments. For children, we're going to use things like play therapy and art therapy that are more age appropriate. We can't just spend an hour sitting face to face and just talking to a child. That's not always going to be effective. So there are different therapeutic modalities that are very appropriate for children and very effective. Again, we're going to explore the possibility of medication. Exercise is a natural remedy for depression, and that's supported by research too. Now, I know right now people aren't able to be in the gym. I know the ability to have a regular exercise routine might be disrupted, but if you can just get a little bit of movement in every day, and if it's just walking around the block or just walking up and down your steps a few extra times, just having that movement can be a natural remedy for improving our mood.
Mm.
So recognizing early warning signs, as I said before, I'll give you an example. I knew somebody a long time ago who struggled with major depression. And a warning sign for her, she would put a load of laundry in the washing machine and she would let it sit for days to the point where it would mold, the clothes would mold. And that she came to recognize that that's an indication that I am spiraling, I am moving deeper into a depressive episode. Because when she was healthy and functional, that didn't happen. She did her laundry, she was done. So recognizing red flags like that, we all have them. So the key is learning to pick up on those sooner rather than later so that you can start to cope more effectively, or call your doctor or call your therapist if you need to. Enhancing our social support system. So how do we build up that social support? How do we reach out? And that can be hard with depression because the tendency is to want to isolate and just go inward. So being very intentional about building that social support system can be really helpful. Set reasonable goals and expectations. I think this is really important now. I know I have really had to redefine what my goals and expectations are for myself, my work, my children, the way my house looks. When we're struggling with depression, it is okay to readjust those expectations and to set them lower. And that doesn't mean that we're getting rid of the quality of something or that we don't care. It just means that we're being very mindful of what we are able to do in that moment. So that's really a key piece. If the depression is severe enough that it's causing us to think about wanting to hurt ourselves, then we should really establish a safety plan. And that can look different ways. That can be alerting your therapist, alerting your prescriber, alerting family members. I've had clients who they have all their medication, they give it to a family member so that they don't have access to that medication in case they think about wanting to take more pills than prescribed. So there are different things we can do with a practical safety plan to ensure that a person's not going to harm themselves. Okay. In regard to children, so again, we're seeing very similar strategies. I do want to mention for parents listening to this, so suicide is currently the second leading cause of death for our adolescents, okay, age 13 to 19, second leading cause of death, which if we think about that, I mean, just really think about what that means for our youth, that we're at that point. As parents, we have to be having these discussions with our children, and I know they're not comfortable conversations to have. I first want to say that talking about suicide with your child is not going to put the idea in their head to commit suicide. That is a myth, and a myth that has been refuted by research, so it's not true. I just want to put that out there. not talking to them is actually more dangerous than talking to them about it. So I tell families, talk about the S word in your family. Talk about suicide, talk about self-harm. So in the way we do that is we create that sense of emotional safety for our children, where we let them know that you can tell me anything and I'm not going to get upset. I'm not going to act shocked. I'm not going to lash out at you because you told me this. So we have to really own our part as parents and make sure that we're providing that emotional safety for our children. It is perfectly acceptable to sit face to face with your child and say, have you ever thought about hurting yourself? Have you ever thought about wanting to die? Do you have days where you just feel like you don't want to be here anymore? Okay, so it is okay to have those conversations, and it can be life-saving. So don't necessarily wait for your child to come to you with that, because sometimes they won't. Sometimes they don't know how to talk about that, or they're afraid or embarrassed to talk about it. So we have to be proactive as parents and put it out there. And I've had those discussions with all of my children. Even if I don't see any warning signs, I still talk about it with them.
So what are the benefits of medication in dealing with anxiety and depression? What are the limits?
Sure. So there can be a lot of benefits to taking medication for depression and anxiety. I have seen the benefits firsthand with a lot of my clients over the years. So I've had a lot of discussions. Well, let me back up. First, Mike, I do want to let people know that I am not a prescriber and I don't have the ability to prescribe. So what I'm going to talk about today is just some general information and education about medication. And I do encourage anyone considering medication to have a more in-depth conversation with somebody who has the ability to prescribe. So I do want to say that. Some of the conversations I've had with some of my clients over the years, I've had several people say to me, well, I don't want to just take a pill and hope everything gets better for me. And what my response to that is that we don't take medication with the intent that everything is just going to magically get better in our lives, because that's not what happens. What medication can do is that it can provide significant relief for symptoms that are absolutely debilitating to people. So if you think about what depression and anxiety does, it disrupts our most basic functioning. It disrupts our sleep, our appetite, our motivation, our energy. So if our just basic aspects of functioning are disrupted, think about how hard it's going to be for us to manage work stress, or to manage stress in a marriage, or to deal with the difficult decisions we have to make on a day-to-day basis. So medication can provide some relief for these debilitating symptoms to better position us to then start tackling some of the deeper issues that we're experiencing in our lives. So medication, if we find the right one that works for us, it can help with restoring sleep and appetite. It can improve motivation, energy. It can help provide that mood stability, decrease racing thoughts. And for some people, it can even help provide a reduction in self-harm and suicidal thoughts and behaviors, which obviously is very crucial. With any type of medication, there's always going to be some level of risk involved. So some of the common risks involved with medication are the potential side effects. There's side effects for all medications. So this would be a conversation that you would have with your prescriber. What are possible side effects for this medication? And you would just look at that kind of a cost-benefit analysis. Is it worth it to try this medication based on what potential risks could be? Cost of medication can be a barrier for some people, especially if they don't have health insurance. And even having health insurance, sometimes medications are still too costly, even with health insurance. Some medications like antidepressants can take a long time to be effective. Sometimes it can be 4 to 6 weeks before a person really starts to notice the difference. So if you choose to use medication, you just have to go into the decision mindful of that it's going to take some time, and we just have to stick with it. Medications aren't always going to be that magic bullet that enters our body and just makes things feel better within a matter of hours. It sometimes is going to take time. And then there's the stigma. Some people feel a stigma with taking medication or even going to therapy. And fortunately, I think we are moving away from that. I think that's gotten better over the years. So what I want to say to that is, please treat your mental and emotional health the way that you would treat your physical health.
Hmm.
Most people wouldn't think twice about taking medication for their heart or for their blood pressure. They would simply take it if their doctor prescribed it, if it was necessary. And we really have to look at our emotional health through that same lens. Health is health. And our mental and emotional health is not separate from our physical health. It's all interconnected. So we can't choose to take care of one while ignoring the other. So if you're feeling reluctant because you don't want that stigma or you don't want to have to tell people about it, I would just encourage you to reframe how you look at your emotional health and just deem it as important as any other aspect of your physical health.
Well, yeah, you talked in terms of symptoms that there's physiological effects, because we are, and we as Catholics, we know that we're this profound union of body and soul. We don't separate the two, and so there shouldn't be any stigma really from the Catholic perspective,
Right.
because we are a union, an integral union.
Absolutely. And we know through years of research, depression and anxiety have a physiological basis. It's not just all up in our heads. We're not doing this to ourselves. There is an actual biophysiological basis to both. And sometimes medication is simply necessary to help treat that.
Hmm. Well, this is as helpful as this conversation is. There's also a need for outside resources or other resources that are available, maybe in our community or even broader. What are some outside resources that you would recommend?
Sure. So I do have, on the next slide, I do have some names of some local agencies, and this is more in the Lexington area. And so right now, in the midst of the COVID-19 crisis, many mental and behavioral health agencies are providing telehealth right now. So there is service provision. It's just going to look a little bit different right now. Some people might want to wait until we're able to see people face to face again. I think that's a decision you can decide as a family. But these are some local resources that we have that offer a variety of services, therapy, medication, testing services. So I do encourage people to research these a little bit further, depending on what your insurance is. You might have to look at some different ones to see where your insurance is accepted. And this certainly is not comprehensive. These are just some of the agencies that are available. There are others as well. If we go to the next slide, Mike, and perhaps, Mike, is there a way to make these resources available or maybe post them later on too, so people have an opportunity to go back and look at them?
Absolutely, sure,
Okay.
it does.
Perfect. And these are some websites for families too that just have some educational resources and tools that they can use for themselves and for their children. This last one here, the Psychology Today, the Find a Therapist resource. This is a great website. This is where you can put in your location, you can put in a specific issue that you're dealing with, you can search by insurance. This is just a really helpful tool. If a person is looking to find a therapist, but they need something very specific, this website makes it really easy and just really helps narrow down that search based on your needs and based on your resources. So I do encourage people to check that out. And these are some apps. So the reason I'm recommending apps, especially for our youth, because so many of us are on our phones anyway, and I mean, it's just the way it is. So these are some helpful apps that you might want to look into just to help with anxiety symptoms, depression symptoms. Some of these provide some mood charting. Some of these walk us through different relaxation techniques. Some of your teenagers might be more receptive to using an app than using some other tools, or maybe even more receptive to using something like this and sitting down and talking to us. So I just wanted parents to have an idea of some potential apps they could use either for themselves or for their child or teenager that might be helpful.
So the last question that I'll ask you, Dr. Terhune, how can our Catholic faith guide us on these issues?
Sure. So I think what our faith can provide for us is a sense of hope and purpose that transcends how we're feeling right now. A lot of us are struggling from a feeling standpoint, and especially in cases of depression and anxiety, we might feel fear, we might feel hopeless, we might feel despair even. And so what our faith provides us is a sense of knowing that transcends how we feel in that moment. And it's hard. It's hard keeping our focus on that when we're so immersed in what we're feeling and the day-to-day stressors. But I think first and foremost, that's what our faith provides, is that sense of purpose that transcends how we feel. Research does support faith and spiritual practices as a coping resource for depression and anxiety, which is really good news. And so things like prayer or meditation with the rosary, that can actually be a coping skill for us. And research supports that it can help us be more relaxed. It can help improve a sense of optimism. So from a research standpoint, faith is actually a practical coping tool. And then there's the issue of our faith community and reaching out to our faith community for support. I think we sometimes have the perception that other people have it more together than us, or they're doing better than us, and they're not. I promise you, they're not. We're all struggling, and I think most people would be surprised to learn that our struggles are probably more similar than they realize. So reach out to your faith community for solidarity, for support, for encouragement. We don't have to be isolated in this process. That support is out there. So it's just taking that next step and that leap of faith, essentially, and the courage to reach out and ask for help.
Well, thank you so much, Dr. Terhune, Katie. I really appreciate your friendship and your willingness to share with our parents. We're all walking this road together, and it's good to know that there's people out there who are thinking about these issues and can provide us some practical tools. And thanks to Noah for his guest appearance. And,
yes, thank you, Noah. And thank you, Mike, for the time and energy you're putting into making these presentations happen. We appreciate it.
All right. Well, take care. All right.
Thank you. Thank you.